Hi, this is Dr. Calathur from the United States. I'm a board certified telemedicine physician practicing in the US. I'm going to talk a few words about commonly screened cancers. For breast cancer screening, the main test used is mammogram. Most women start breast cancer screening around the age of 40. Women who have a strong family history of breast cancer might start screening earlier. The usual rule is to start screening 10 years prior to the age of diagnosis of the youngest relative or the usual age of start of screening for the particular cancer, whichever is earlier. Doctors recommend most people to start colon cancer screening at the age of 45. Colonoscopy is the most common colon cancer screening test done, which is usually every 7 to 10 years if normal colonoscopy findings. Cologuard is a home test sent in the mail. If normal, it is done every 3 years, but if abnormal, it is followed by a colonoscopy. Some people have an increased chance of getting colon cancer because of strong family history of certain medical conditions. These people might begin screening at a younger age, and the test of choice here is colonoscopy and not Cologuard. There are several ways to get cervical cancer screening, but one of the most common tests is called a Pap smear or Pap test. For women, screening with a Pap test often begins at the age 21. Doctors might add or switch to another screening test called an HPV test or human papillomavirus test, and that is usually after the age of 30. The main test used to screen for prostate cancer is a test called PSA test or prostate specific antigen test. It is a blood test. It is unclear whether getting screened for prostate cancer can help a person live longer. For this reason, most experts recommend men to discuss this with their doctor to decide about prostate cancer screening. In most cases, people should start discussing prostate cancer screening around the age of 50. For people at higher risk for prostate cancer, these discussions should begin around age 40. This includes Black people, people who have a relative with prostate cancer, and people who have a certain abnormal gene like the BRCA gene. The main test used to screen for lung cancer is an imaging test called low-dose CT scan. For people at increased risk for lung cancer, screening can reduce your chance of dying from lung cancer. If you are 50 to 80 years old and smoked cigarettes or used to smoke cigarettes, ask your doctor if you should be screened for lung cancer. The best way to reduce your chance of getting or dying from lung cancer is, of course, stopping smoking. And please follow or subscribe to my channel. And until my next video, take care and bye.